resources they need, providing family support and early learning services and counseling and foster care and ultimately adoption too, but adoption being a far smaller part of what we do now. And so we took over 2003, as I say. We have a significant difference in cultural approach to it than the county did when it was a social services center, when it was, you know, a little bit like any county office where you walk in, get what you need, and walk out again, or don't get what you need. We pride ourselves on family support principles, which really boils down to we accept families where they are. We help them identify goals, and then we work with them as partners to get to where they need to be. So somebody may come in and need a food basket, but ultimately they've got some other concern that has led them to the stage where they need a food basket. So, you know, part of what we do is figure out ways that they can avoid needing a food basket in the future. So that's sort of what we do. And if you look at the first chart there, these are activities that we add into the center that essentially are not necessarily funded by city dollars. We blend them all together. We try to match up with volunteer resources. We match up with partner services. So these are the sort of the breakdown of the services we provide. When you see Family Advocate Program, that really is that partnership with families to help them actually get to the resources they need. It's beyond information and referral. We do that as well. This is where we actually work with the family to help them get to where they want to be. The next page describes some of those services. We used to have a real clothing closet on site with, at one point we had this huge relationship with Walmart that were giving us all their rejected clothes, and it was an amazing concern. But Walmart and the VFW was an amazing partner bringing the resources in. Walmart sort of changed its program on recycling its damaged, if you like, or returned goods, and we no longer get that. And quite frankly, having a clothing program, what we find works better is having a clothing drive and a clothing giveaway. On the other hand, what we do is partner with Northwest Children's Outreach, which is an amazing program where we place the orders. Families can ask us for specific sizes, and you know, boy, girl, jeans, size 10, whatever. And then we can ask Northwest Children's Outreach and pick up clothing every week. And
baby items and cribs and high chairs and lots of equipment that some people just don't have the money to get. So they're a really good organization in Vancouver.
Yeah, amazing. And later on we have some numbers on the different use of these services too. These are other things that we do. We're very proud of being a training site for WorkSource and PIC. We wouldn't be able to actually run the center with one primary staff person if we didn't also have PIC, we call them volunteers. It's a training program where we provide training and they provide us with up to 20 hours a week working on the desk, and they really do perform a job. They're only there for 6 months, but we find it an amazing program. And I think we did the research, and I think it was maybe something like 85% of the volunteers who came through our program left to go to a real job, which is quite something with that program when you come with some of the barriers to employment that people from WorkSource and PIC have. So. Apart from what we do ourselves, we've then got the partners. WIC has just changed recently. It used to be provided by the health department. It's now being provided by CMAR. And that is a real prevention initiative. There's a lot of focus on childhood obesity right now, and this is one of those programs that sets children off to a good start. And WIC has got pretty creative. They now do the farmers market vouchers include Washougal Farmers Market. So those sort of local connections are really kind of neat.
They've expanded their hours recently too, so they're open more days per month than the health department had them open. So the flow of people is a lot easier. You don't have 20 people in the waiting room at once, maybe you'll have 10, so.
Yeah, and it's really nice, because what is neat about this model is somebody comes in for WIC, they get childhood immunizations or a screening and wait. But when they're in there, they see the resources that we have, and so they can access and they learn about parenting classes, or they learn about home visiting, or those sort of things, so.
Local school lunch programs, we just put flyers up for any community-based events or resources for the families. So they're learning that they can ask us for those resources as well, so.
As you can imagine, we've seen a real increasing need over the years we've been there. We actually have some charts that I think I put towards the end, but, oh no, they're not, they're 2 pages over. We have seen people who used to be donors now become recipients of emergency food bags. We are not a food bank as such. What we do is supplement resources. We don't have the commodities program. Treasure House does the food bank program. We supplement those sort of resources, and we can also serve some families who don't receive Treasure House resources, such as homeless people who are they don't have the paperwork that's often required by regular food banks.
And we also don't restrict how often somebody can come and ask for help with food, diapers, formula. Some places we give them lists of resources so they can go to Treasure House or other food banks if they're from Vancouver, but we just want to make it really easy for people to come in and ask for the help and get it without any documentation besides a form that we ask them to fill out. So if we have it to share, we share. That's sort of our motto. If we have it, we'll give it to you. So.
As you can see, the people we serve are primarily Washougal residents, the zip codes. We did an analysis just on our data system, which is why it says FIS report, that these are unduplicated numbers, so that, you know, these people are like 335 from 671. That is a very small portion of those we actually serve, and the number of those come in multiple times. So you can see when you turn the page, you can see what the usage has been like. Oh, weirdly, Renee's thinking backwards. The years are along the bottom. Took me a second to figure out where they were. But you can see the changes that have occurred in these two primary resources: emergency food and clothing. The third set of columns is our in-kind donations. Without those, this is the most amazing community. People walk in and give us things to give away. And we're in the middle facilitating this exchange. Like the US Post Office, when they have damaged mail that stacks up in the corner every so often, they just bring it all over to us, you know, sample sizes, samples and things like that.